Coming up, Robin Leach, the lowdown on the summer's hottest celebrity parties, and sexy new singing star Francesca Begay, plus lots more. So forget about those errands and stay right where you are, okay? Okay.
From New York, Joan Rivers.
In case you've forgotten, last May we announced the two couples that would be working with Dr. Sherman Silber from the St. Luke's Hospital in Missouri. You can see them here meeting the staff, getting started, and going through the various fertility procedures at the hospital, meeting the doctors, getting results. Oh, see that there on the screen? Okay. So far, each couple has been poked and prodded and pinched in hopes of conceiving a child. Now we're going to find out where we stand. Will you please welcome back Linda and Elmo James, and Kathy and Jim Frost, and our resident expert, Dr. Sherman Silber, author of How to Get Pregnant with the New Technology. Okay, and tell me what's going on. Two couples, where do we start? Let's start with you two first. You went there and?
And we had IVF.
Which is what?
Which is in vitro fertilization.
Okay.
Okay.
And one time you did it.
Right, right. When I got there, Dr. Silber actually found I had more problems than on my video that I actually sent it in the beginning.
Thank God we didn't know ahead of time. You wouldn't have been chosen. Right. That's very lucky.
So what really amazed me was the fact that I never knew what my problem was before, and immediately he found out what the problems were.
So you wasted how many years?
About 10.
Quite a few in there, yeah.
A lot of years.
Yeah.
And you've already done the procedure once.
Right.
And it didn't take.
Right.
And they said you were very depressed.
Yeah.
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 But you should know that they're going to do it again.
Right.
And again. You may end up living in St. Louis for the next second. You may end up being the next Mrs. S. But you do, because for a while you said you wouldn't want to go back.
Well, it's the fact that it's a lot of work, actually.
Yeah.
No one should think it's easy.
What's the work?
You have to be everywhere. You know, the hospital staff is wonderful, and you get there, and they poke you and prod you, like you say, and you come home, and you feel like you're being poked and prodded all day. And once you get, and then after the procedure, there's a 2-week wait, and that really kills you. The anxiety, you know. Yeah. If you belch, you think, oh, I blew it.
Yeah.
So it's a lot of stress. It really is. And after it was over and I found out that I wasn't pregnant, I was depressed.
Of course, it's such an excitement and it's such a letdown.
Yeah.
But I think the next time maybe, because you go into it with more negative feelings.
Well, I go into it knowing that we did everything that we possibly could, and there's no reason why it didn't work. That belch didn't cause it not to work, or anything Dr. Silber and the staff didn't cause it not to work. It's just, with IVF, it takes more than one time. Okay. And if you really want something, you keep doing it.
Because I expect you to be on the show with the baby. That's going to be the Christmas special. So you have to hurry. Right? Oh, well, we could put a bow around her stomach. So we can work it that way. But you must keep going. I don't want to hear no. I'm very upset when they tell me that. Now, tell me about you two.
Well, we have good news.
Yeah.
We had the gift surgery, and it was successful. And I'm about 6 weeks pregnant now.
That's great. We're going to go back. Just in case you're nauseous, they gave us something. And they also showed us a picture of the baby, and we'll talk more about what each, again, procedure was, and Dr. Silber, again, what women out there can do. So we'll be back in a moment, and then we'll take a look at the picture of the baby. All right? Isn't that great? Talking with Linda Elmo James and Kathy and Jim Frost, and our two couples who were selected for the Gift of Life program, and Dr. Sherman Silber of How to Get Pregnant with the New Technology. Now, After this baby, if she wants another baby, which they probably will, because people become smart. They say, this is nice, let's have another. Will that do the same way again?
Well,
or will it become easier?
Yeah, they can have any number of babies they want, but we found about 20% of women like you, Kathy, will get pregnant on your own after you've had a successful pregnancy with this technology. We don't know why, but if you don't get pregnant within a reasonable period of time with your second baby, we'll just do it again. And the odds are 50% you'll get pregnant in the first try.
And this is what happened with her.
Exactly. The pregnancy rate is very high with the gift procedure. With in vitro fertilization, it's a little lower. When Elmo and Linda came, we found out their tubes were clobbered. We found out she had very, very little ovary tissue, so she had bigger problems than we anticipated, but not insurmountable problems. And so we'll be able to work with her and get her pregnant eventually.
Does attitude mean anything? Because we all hear all these old wives' tales. You know those things, if the mother is happy during pregnancy, the child... I believe none of it, but I sang the whole time to my stomach. I talked to Melissa. You know, I did everything. Is attitude...
Well, I think attitude is very important. It's medically controversial, but what happened here is these two couples went through it together, and they were very supportive of each other. And Linda, who did not get pregnant the first time, I know, became a very close friend with Kathy and was very supportive. And I have to feel that that was a very important part of the whole process.
And much more difficult, I think, for you, that the other one, I mean... Well, you're thrilled for someone, but
I don't like her anymore. No.
Yeah. But you've got to say, you know, it's not there. Right. At what point, and I don't mean them, because you've already said that there's, you know, terrific chances of... What point would you say to a couple, this is silly?
It depends on their attitude. Even if a woman is like 45 and has no ovary or eggs left, if she's interested in donor eggs, you can get pregnant when you're 60. I mean, there is no point to say no unless the couple decides they just don't want to go through it. But with this technology, if you're very open-minded and really want a baby, anybody can have one.
Anybody can have one. Just keep that in mind. Yeah. We'll talk to each other while you're doing it. You know what I'm saying? Because she's not going to be there anymore. Now, are you going to go home? You go home now and you just go to your own doctor? Mm-hmm. It's a totally normal pregnancy now.
Completely normal pregnancy. That ultrasound looks beautiful. Heartbeat looks fabulous.
Isn't that? And how old is the baby here?
About 4 weeks.
4 weeks. Isn't that amazing?
Yeah, her doctors are pretty excited, aren't they?
Yeah. And are you nauseous and all the stuff?
A little bit. I haven't thrown up or anything yet, but I've been kind of queasy feeling.
Good. Wait till you throw up. It's a pleasure. You'll be so happy. I thank you. I'm so happy for all of you. We'll keep in touch. So if you're feeling lousy and depressed, we'll talk on the phone. I'll scream at you, all right? I'll be your old Jewish mother, all right? And thank you so much. Congratulations. I'll be saying that to you very soon. And, Doctor, the book, even I read it. Thank you so much, and we will be right back.